You talked about in a recent article about the Zoom boom. Can you describe what that is? It's such a cool name, the Zoom boom. I like that.
The Zoom boom. So the Zoom boom is that when we came out of the first lockdown in end of May, beginning of June, you had people who had just spent, 2.5 months, all of a sudden transitioning to Zoom calls, Skype, iPhones, whatever it was. And they are now spending hours on hours looking at themselves, and not just looking at a straight picture of themselves, looking at themselves in animation. They can see when they're frustrated. They can see when the camera's looking down, looking up. And I think there was a study out of Harvard. There's a great researcher, Nancy Etkoff, and she writes on the science of beauty and why beauty matters. And she spoke about a study that they tracked what you looked at when you were on a Zoom call, and 80-90% of the time you're looking at your own image.
Yeah, I believe that. Yeah.
Yeah. And then the other interesting thing I think is like men, I mean, this is my take on things, and maybe it's just, I don't know. I think it's the same for me. I get up in the morning, brush my teeth, put on some makeup. I don't look in the mirror the whole rest of the day. And I think maybe women might primp a little bit more, put on some lipstick halfway through the day. But the amount of men that came in because of that Zoom boom afterwards was, I think, very disproportionately high compared to the regular percent of men that I'm seeing. So all of a sudden, you guys are seeing what you really look like.
And not liking it.
Yeah.
So would you say that when somebody looks, what do you think people are looking at, particularly when they're looking at themselves? I always I'll tell you what I'm thinking here.
Yeah.
I always tell my patients that when you're looking at someone else, you're staring at their eyes and kind of their peri-orbital area, and you're assessing everything about their lids and their crow's feet and their eyebrow position and their forehead. But then when people look at themselves, I think a lot of people are like this. They're looking at their lower face, and they're staring at their necks and their lower face, and really hard on their. I mean, I think the neck is kind of the thing we're hardest
poor
on.
Neck.
The poor neck. This is poor thing. I mean, do you find that?
I think so. I think I think you're right. People look at eyes, they look at the mouth when they're chatting with people. The other thing that everybody else sees that we don't see is you don't have a conversation. Like you and I are having a conversation literally face to face right now, virtually face to face, I guess.
Yeah.
But usually when you're talking to someone, you're in a group, you're around a table, you're at a party, and you don't usually go right straight face to face with people. So most people see ourselves from the profile and from the oblique, right?
Right.
So that front on picture is not what most of the world sees. So people start obsessing about symmetry, this side versus that side. And for the most part, I don't think that the other people are assessing that. I think when we look at ourselves, we'll hone in on like one individual feature, like it's a line or it's the neck, it's a wrinkle or a brown spot. But really, when I do assessments on patients, I try to zoom out. I learned this actually from great dermatologist, Dr. Vince Bertucci, is he kind of in his mind almost blurs the patient, takes a look and really assesses the overall shape and balance of the face first, and then we'll start honing in on features.
Yeah, that's a great.
It's hard to do for yourself.
Yeah, that's right. You're right. You tend to just hone in that one thing that bugs you about yourself more than anything else, as opposed to taking a step back. What do you find people come in asking a lot for, or what kind of treatments are they requesting?
I think lower face, as you said, it is one that people tend to focus on a lot. Still the classic nasolabial fold, which then, requires education to sort of back up and talk to people about, where does that fold, because this is a nasolabial fold for people who aren't doctors, but, where does that come from? Why do we have that? And to steer them away from just simply, okay, we erase that line and you're going to look better. So it's just about, the whole look. People will come in for Botox, for particular lines. But then again, I like to re-educate about it's not just about the lines, it's about balancing the pulleys and the levers on the face and giving you, you know, arrested appearance. I don't want to just like zap out that one line. That's
Yeah.
not really going to make you happy.
Yeah, I agree with that. It's kind of you don't want to be chasing just one wrinkle. I think it goes back to your earlier point about taking a global approach to a whole face.